Good morning, everyone. Welcome to a very special event for our university, our two faculties, and our institute. We're going to be talking about climate change with our very special guest, Mr. Greg Mullins AO. I almost gave you an honorary doctorate then. Greg, I'd just like to welcome Deputy Vice-Chancellor Psyche Pretorius and Professor Patrick McNeil, Executive Dean, Faculty of Medicine, Health and Human Sciences, and Professor Leonie Tickle, Executive Dean, Macquarie Business School, and colleagues, friends and guests. So we have 1 hour to try and look at this, which is kind of an impossible task, so we've decided to go till midnight. And no, so we've got a three-part event. First part, we're going to hear from our guest, who has got a fantastic CV, and we'll explain that shortly. The second part is we'll talk a little bit about the Institute and its work on climate change and human health, and climate change and health systems. And then at the end, we have a panel of experts from various perspectives to really workshop what you talk to us about, Greg. So that's the plan. So, Professor McNeil is going to help me with the introduction shortly, but firstly, we'd just like to acknowledge the land on which we stand.
Welcome. We acknowledge the traditional custodians of Macquarie University land, the Warramargal clan of the Darug Nation, whose cultures and customs have nurtured this land since the Dreamtime. We pay our respects to elders past, present and future. We welcome people of all nations and all faiths. Kwai Bidja, Jamna Payala Janawi. Come here, we speak together. We have 60,000 years of archaeological evidence of Aboriginal habitation at Lake Mungo and 20,000 years in Ryde. We have great antiquity. Today, hundreds of Aboriginal and Torres Strait Islander people graduate from Macquarie University. The Darug Nation had famous leaders such as Chief Yarramundi, Naraginji, Colby and Maria Locke. Many of the descendants of these Darug people live today amongst you. We celebrate with you our ongoing attachment and custodianship of this country. We celebrate the achievements of Macquarie University.
So I'd like to add my respects to elders past, present and emerging, and recognise this fantastic plot of land that we have custodianship of here at Macquarie. So could I introduce Professor Patrick McNeil, the Executive Dean of the Faculty of Medicine, Health and Human Sciences, and also Deputy Vice-Chancellor, Medicine and Health. Patrick.
So thanks, Jeffrey, and welcome everybody to this Warramargal campus. As Jeffrey says, it is an important privilege we have to follow on from traditional custodians of this land. Auntie Julie Jansen's words are always quite powerful every time I see that video. I've seen it so many times. I think about actually one image from that, which is the fire. Fire has always been very important to First Nations culture and life. And our speaker, who will be speaking as soon as I get out of the way, knows about fire a lot. And you know, there's things, I believe, as we walk in partnership with our First Nations brothers and sisters, we can learn about modern life. Their use of fire probably is something we should learn about as well. So climate change is something that it's a wonder we're still talking about, and it's good that we're talking about climate change and health rather than is climate change real. I've never really understood that question. Do you believe in climate change? Well, as a scientist, we don't believe in anything. Actually, science is probably the most humble pursuit there is, because actually you don't believe in anything. You test it. And in fact, even, people say, oh, it's a fact of that. Actually, if you're a scientist, there are no facts. There are only observations that create a framework that is consistent with the observable data. And so science should continually be revising the facts and revising, our understanding of the world. In many ways, that's the beauty of science, is that you don't actually believe in much at all. Of course, you can have your belief systems, but perhaps they're in a different domain to how you study and understand the world around us. So, based on all our observations, it's been very obvious that our climate is changing and has been changing for many recent decades. It's kind of moved from the scientists, Paul's here in the front row, who started that work, understanding the science of the climate, to really now being a societal issue is how do we communicate to our people? How do we create policies? It's almost a humanities issue now, the whole issue of the changing climate. So it's been very interesting to observe over many decades. I guess in the area of health, we've been worried about the effect of a changing climate on the people that we look after who come to us for health needs, the way we educate future health practitioners. And we've also realised that our health system actually is a contributor to our changing climate. So I think it's terrific that the Australian Institute of Health Innovation has actually been interested in this issue over, really as a kind of one of the first health systems researching organisations to actually start exploring what are the health implications broadly of the health system, how will the health system need to adapt, like every part of our society, to do its job and to minimise its impact. So congratulations to Jeffrey and all the team at AIHI for actually getting on the front foot and taking this on many years ago. So it's a great pleasure to, and I think Jeffrey might introduce our guest speaker more thoroughly, but it's great. Oh, it's always a privilege to have a Macquarie alumnus back and someone as distinguished as Greg Mullins. So again, I'll get out of the way and we'll hear what is the most interesting we've come for. Again, welcome and thank you.
Thank you, Patrick. Well, we've circulated Greg's CV, but let me just, by way of introducing him, point out a couple of things. The way Greg thinks about himself is as a firefighter. He's been a firefighter since 1972. And he was Commissioner of Fire and Rescue for a big chunk of his career. But more recently, he's been really looking at climate change in a much more broad way. He's looked at firefighting in several different countries and really brought all that deep knowledge of, well, how do you deal with a changing climate when it affects something so profound as like the bushfires in only 6 years ago in 2019? How do you deal with that specific kind of problem? But then how do you provide your expertise to different organisations such as the Emergency Leaders for Climate Action and the Climate Council and bushfire organisations and Doctors for the Environment and all the other places where Greg's given a talk, to try and help with those observations, Patrick, to make his observations understood in the wider world. And that's what we're going to hear from now. So could you please welcome Mr. Greg Mullins.
Thanks, Jeffrey. Now, I push the button, do I? Phew, it worked. Good morning, everybody. It's great, and thanks for those comments, Patrick and Jeffrey. And it is a pleasure to be back here because I did my master's at the old MGSM. My mother studied here, my son, my daughter. So I was lots of graduations over the years, and it's really nice to be here. But look, I just want to thanks for mentioning fire, Indigenous use of fire, because cultural burning absolutely fascinates me. I'd like to acknowledge that Wallumattagal people of the Darug Nation. Pay my respects to elders past and present. But one of the welcomes to country that really impacted me a few years ago, I went to a function and an elder said, hands up who still lives where their parents lived. And a few people with their hands up, where your grandparents lived. A few hands went down, where your great-grandparents lived. And then he said, well, your great-great, and there was only one hand. And he said, hello, sister. And he said, where I live, we go back probably 1,000 generations. And I was gobsmacked because after the Black Summer bushfires, I wrote a book about my experiences over 50 years and how the climate had changed, called Firestorm. And in there I talked about my father and mother teaching me things about the environment. And Dad used to watch ants and say it's going to rain, it's going to rain really hard, they're going for high ground, they're swarming, that sort of thing. He'd watch certain species of wattle that used to flower early, like they are now, and he'd say, uh-oh, we've got a bad fire season on the way. And someone said to me, gee, that's like the passing down of Indigenous knowledge. And I actually felt embarrassed. I thought, that's one generation, and our family's been here a couple of 100 years, and it's sort of disrespectful to those thousands of years of knowledge that we just discarded. Our forebears just thought they knew better, came from another part of the world. And it's so nice to see it coming back and being acknowledged properly. So, I particularly pay my respects to cultural fire experts who have taught me so much, but only that much of what they know. Now, what I'll talk about today, it's a little bit about me, the changing risk environment, the climate change impacts, and as Patrick said, it's just science. If people don't want to believe in it, that's fine. They can believe the world's flat. They can believe whatever they want to believe, and that's their prerogative to be absolutely wrong, like one of our world leaders at the moment. I'll try and only get, that's about as political as I'll get. But it's become a political issue which astounds me because back when Margaret Thatcher was Prime Minister of Britain, she's a conservative, but she was a scientist, and she was one of the first people to say, this is real, we must start doing things about it now. Health implications, of course, but this is going to be from a firefighter's perspective, so I'm not going to pretend I'm a doctor or a medical researcher, but hopefully what I say will make sense. I'm going to give you a bit of a journey, Climate Change and Fires 101. I hope it doesn't bore you, and we'll see how we go with that. Now, just a little bit about me. I started fighting fires actually in 1971 when I was 12 years old. Dad was a volunteer firefighter. We lived over the road from the fire station. There was a big fire. You can read my book. It's cheap. It's a good book. My first big fire, I was hooked because it was exciting, it was interesting, and it was terrifying all in one. But I decided when I was 12 what I wanted to do for a career, what I wanted to do for the rest of my life. So fires have worsened worldwide in my short period on this earth, and it shouldn't have. It's geological time, but everything's sped up, and I'll talk about why that is. In 1995, after the 1994 bushfires, I was in charge of the Lane Cove National Park fire. I worked in the Blue Mountains, Terry Hills, all over the place, but I ran this firefighting effort. We lost 17 homes, 33 others badly damaged, nearly lost some lives. And that was a wake-up call to me. So the next year I put in for a Churchill Fellowship and went to Spain, France, Canada and the USA and studied how they were dealing with fires. So firefighting, public service, part of the family. There's my dear old dad. He's left us now. That picture that's me with the dog. That's just down the road, Winchester Avenue, Linfield, and 6 homes on fire, no fire trucks, and I turn up and someone said my wife's in the house at the end of the road, and it was things blowing up. It was pretty hairy. That other photo next to my dad and I, that was Bateman's Bay, New Year's Eve 2019, and that was about, the 20th burning house we attended. We lost about 630 homes that day. It was pretty awful, but public service was in the blood. My mum was a school teacher, Dad was with Public Works, and volunteering, environmentalism was in the blood. So that's me. And I'm back as a volunteer firefighter after my career of 39 years. Now, just a little bit of Climate Change 101. So the concentration of CO2 in the atmosphere from mid-1800s, we'll say, around about, don't hold me to it, but from the start of the Industrial Revolution, there was about 280 parts per million CO2 in the atmosphere. As of April this year, 428.55 parts per million. So it's just skyrocketed since then. It was stable for hundreds of thousands of years. And as soon as we started burning coal, oil and gas, up it went. Now, the effect of CO2 has been known scientifically since about 1850. An Irish physicist called John Tyndall experimented it and showed that CO2 and water vapour absorb heat from radiant heat from the sun. So, and by the early, I think 1900, Dutch physicist Arrhenius, I think his name was, coined the term greenhouse effect. And so this has been known for an awful long time. Now, what that graph shows is the concentration of CO2 going up and the number of years that are above or below average temperatures. And you can see the temperatures just keep going up. And it's literally not rocket science. It's really simple physical science that this is what's happening to the planet. And for anyone who thinks, oh, it's volcanoes or it's natural or it's whatever, well, sorry, the isotopic signature of the CO2 in the air shows that the vast majority is from plant-based sources from millions and millions of years ago. So it's known for certain. So like one world leader can't or doesn't want to understand that, bad luck. It's just happening, dude. Get over it. Try and do something about it. And he is, because everyone's buying electric cars because he closed the Hormuz Straits. But anyway. So what's it doing to bushfires? Now, this is a made-up slide. So if you're marking me on an honorary doctorate or something, don't this one won't work. But so I'll talk about these particular fires. But Canberra 2003, Black Saturday 2009, big fires in Tasmania and New South Wales in 2013, then Black Summer. They were definitely results of a change in the environment. There's attribution studies been done, and I'll talk about why they were so unique. Who knows what future fires are going to be like? There's a study that frightened the hell out of me, I'll say, after the 2019-2020 fires, Sanderson and Fisher, 2020, said that by 2040 on current rates of warming, the weather we experienced in 2019, which up till then was the hottest, driest year ever recorded on the east coast of Australia, will be an average summer. So most summers will be like that. And by 2060, it will be exceedingly cool. So imagine what the fires will be like by then. Now, why Canberra? So very quickly, Canberra 2003, does anyone remember those fires? Was anyone there? Yeah, okay. And sorry, I hope you weren't personally affected, but I've always got to check. It can be traumatic for people to recall these things. Those fires, 488 homes burnt that day. But what was phenomenal from a fire science perspective was it was the fastest spreading bushfire ever recorded anywhere in the world. It was about 23 kilometres per hour moving through the bush, which is hard to imagine. Mightn't sound like much, but it's gone. It's just, it was the first large fire tornado ever recorded. It was a couple hundred metres wide. Trees that thick were snapped off like toothpicks. A lot of the homes that burnt down, their roofs were ripped off, sparks dumped into the furniture and everything inside, and that's why they burnt. Some homes were just blown apart by the tornado. But it was just this wild condition. There was one fire crew from ACT Fire and Rescue. They found their burning fire truck and thought there'll be bodies in this truck. And as the crews walked up to it and looked at this smoking mess, probably half an hour after it had burnt, a grate in the road moved and up came 4 smelly firefighters who'd got into the sewer. They're pretty smart, but they survived by, their fire truck stopped, the air filter caught a light and they were overrun. So they went below. Victoria, 2009, did anyone go through Black Saturday? Good. That was a horrific day. It reached 47 degrees in Melbourne, 5% humidity, storm force winds from the north, followed by gale force winds from the southwest, which is a typical fire setup in Victoria. And around 2,000 homes were destroyed that day, just that afternoon, but 173 people lost their lives directly to fire. And particularly in Kinglake, about 103 people lost their lives in the community of Kinglake, and every home, every building was destroyed. I don't think any survived. There might have been 1 or 2 buildings survived. But I'll talk about pyroconvective storms. They had a pyroconvective storm above them, and there's nowhere to hide. I know, I've been through it, and I'll talk about that. But so that was an oh my God moment for everybody in fire science, firefighting, policy. Blue Mountains 2013, why was that? There were 225 homes burnt in October 2013 in New South Wales, which was the most ever to that date. Now, what was remarkable about that? It was early October. We'd had fires from September. The bushfire season's not supposed to start until 1st of October. That's what the legislation says, because it was based on 100 years of observations. But we had this extreme weather. We'd never lost homes until before mid-November, prior to those fires. So here we are 6 weeks earlier. And the other thing that really actually frightened me was we'd never had major property loss fires without the intensifying effect of an El Nino event, and there was no El Nino. At the same time, Tasmania was burning. They lost about 200 homes. And I won't go into Tasmania, but their frequency of fires, big fires, used to be about 40 years, 1967, late 90s, going back to the 1800s. They were getting fires every 3 or 4 years from the early 2000s, and bad fires. So, and they're warming a bit quicker than the mainland. Now, what happened after 2009, and I was involved in this, I was Commissioner of Fire and Rescue, I was the President and Chair of the Peak Council for Fire and Emergency Services in Australia and New Zealand. We had to change our national doctrine. There was a Royal Commission into Black Saturday, and it said, we love you firefighters, but you let us down. You didn't tell people what you knew, and actually you didn't know enough. You didn't put enough effort into intelligence gathering and then warning communities. So they didn't know what to do or where to go. And people were killed in cars, and we've known that for decades. Ooh, sorry. And we had to change the fire danger rating system. We added a danger rating of catastrophic. Now, it used to go to extreme. Catastrophic was over 100, the fire danger rating system, 0 to 100, 0 too wet to burn, 100 extreme, you won't be able to put it out till the weather changes. But we were regularly getting fire danger indexes off the scale. So Black Saturday, 220. And it took us years, it took a bushfire CRC about 5 years to work out some of the observed fire behaviour and how it could have happened. And I remember this particular video of a fire going up a hill and engulfing a house. I must have watched it 100 times because I had no idea what was happening. Physically, things that I thought were impossible were happening with that fire. It was just so intense, so fast, and they were able to eventually work out. It's all about heat. It's all about drying and the quality of combustion. So we added that catastrophic designation, and we'd always said bushfires are survivable. If you have a well-prepared property, you can stay and defend and you will survive, and so will your house. All bets were off after these 2 sets of big fires. We said no, on the worst days you need to get out of there the day before, and we might not turn up because there's probably nothing much we can do. So emergency warnings, phone apps, etc. Now, what sort of things are happening? Now, the big one, that I was under that. That was over Bateman's Bay on New Year's Eve 2019. That's a pyroconvective storm. So pyro meaning fire, convective heat storm. So all the water vapour from the burning vegetation goes up. The hotter the fire and the more intense the fire, the further it goes up, gets up into the stratosphere, 10, 13 kilometres, water vapour condenses, forms a cloud. It's getting all those inputs. There's an unstable atmosphere already because that's when fires are at their height. And it's literally a thunderstorm but no rain. So you get downbursts, you get cells collapsing with storm force winds going in every direction. And it's hell on earth. Aircraft couldn't fly, so we had no air support. We ran out of water. Hundreds of homes lost that day, and we were dodging trees. And I honestly thought I was in charge of a fairly big group that had come down from Sydney, and I just thought, we're not coming home. I didn't think we'd get home, but we did. We got through it. Now, to give you an idea, from 1978 to 2018, there were 60 events Australia-wide recorded. In a 6-month period during those fires, there was about 45, probably more. So it just exponential increase because it was so hot and so dry, and the combustion was so much more complete. The number of kilowatts per metre of fire front was measured, estimated around 150,000 kilowatts per metre. So imagine 150,000 1 kilowatt bar heaters in a 1 metre. So it's the energy of a huge atomic bomb, but of course slower release. So the other thing, fires are burning overnight. So my dad taught me over the decades, during the day we've just got to steer it around structures and people, but at night we get in and we do the hard work. We put the fire out, we'll back burn, we'll find a road, we can light a small fire that'll burn back into the big fire, starve it of fuel, and that's how we get around it. So we'd always say, try and put it out by sunrise the next morning. And what we found a lot during that black summer, because it didn't cool down, was the conditions didn't abate overnight. This is a worldwide phenomena. Same thing happened in Los Angeles, Fort McMurray in Alberta in Canada in 2016. Because it's so hot, you don't get moisture reuptake by the vegetation. You don't have, what are they called? Temperature inversions that stop the convection columns and therefore stop the winds building. It just burns like it's burning during the day. 21st of December 2019, I was at Hat Hill Road, Blackheath in the Blue Mountains, and we'd been fighting fires all day, trying to get home about midnight, and this fire came out of the valley. It was unbelievable, probably 60-metre flames, and we're just ember storms, and I ended up quite sick, badly dehydrated, in bed for a couple of days with aching kidneys, and my nurse wife was not happy. Why didn't you go to hospital and get some fluids put in you? But it's but that's happening increasingly because of the hotter temperatures. So Black Summer, I think you know about this. Was anyone personally affected by Black Summer? No, good. Probably about 9,000 buildings destroyed. And in New South Wales, those 2013 fires, 225 homes. That was worst up till then. We lost 2,476, and it didn't hit major metropolitan areas. Sydney, Newcastle, Wollongong, Central Coast, where we usually lose big numbers of homes, weren't hit. So imagine if it had. We'd be looking at what I'll talk about America next slide. So now 33 people died because of fires, including 6 firefighters, but 417 at least were killed by the effects of smoke, and talk about that a little bit later. It's happening worldwide. Now, that satellite shot Chico, Paradise, does anyone know what happened to the city of Paradise in 2018? 18,000 homes destroyed, and it came through in the morning, and I think it was 102 people killed. So that's in Northern California. I've worked in California. I've been in that area, worked in Los Angeles with the fire department. And then January 2025, Los Angeles burned. And people might say, oh yeah, they always get fires. Well, 16,000 structures. The biggest prior to that was 1,700 in, I think it was 2021. I can't remember. But it was winter. It was January. It should have been raining. And they'd never had big fires past November in Los Angeles. And I'd worked during Santa Ana winds. So talk about that a bit more. And what's the next slide? No, I'll get on the international stuff a bit more. And look, a lot of people think 3 minutes, oh my God, I've got to speak quickly. It's very subtle, it's big things. It's 3 minutes. So I'll get through this. So we can't use aircraft on the worst days, and they're not a silver bullet. Hazard reduction burning, which is our biggest large-scale mitigation tool, it's either too wet or too dry and windy. And I've been involved in operations where we've lost the fires and had to chase them for a day and put out emergency warnings. Northern Beaches, North Head, Beacon Hill, not that long ago, because it's just so dry. Now, places, I did an interview with The Guardian last night about bushfires in the UK. It's burning at the moment, never used to. I went over there 4 times to brief fire chiefs on what they needed to do to prepare for climate change and bushfires from 2004. But a 40-degree day in London, 41 homes burnt down on the outskirts of London, which is just unbelievable. Los Angeles, urban conflagrations like Lahaina in Maui, Colorado in 2020, that's increasingly what we're seeing because of wild wind, which is the main thing. Once it's dry, you don't actually need high temperatures. If there's high winds, you will lose lots of homes. And look, now, so what are the impacts? I've had to deal with people on the worst days of their lives in lots of different scenarios over the years. But after bushfire, the whole community's devastated, and you get some fear, terror, panic, fear that they'll lose their lives, not knowing what their loved ones are doing, where they are, because there's no communication, and just this powerlessness, and that can lead to post-traumatic stress disorder. And I suffer from PTSD because of a whole lot of different stuff, and I was doing pretty well. And after that summer, I was back with my psychologist doing my eye movement desensitisation and reprogramming because I was just blindsided by the things I saw and found it very hard to cope. And I remember going back to Bateman's Bay with a 60 Minutes crew from the US. And I went to show them the one house that we saved. And I was out the front and it was in ruins. And I just broke down. I couldn't, because we'd worked so hard to save this house, but there must have been a fire in the roof or something. And, hundreds of, anyway, and it was tough. But survivor guilt, my house survived and I'm the only person left. Anger, all the socio-economic things and health things that come with homelessness. So living in tents when the subsequent rains came. Burns, cardiovascular impacts from smoke, and those prolonged smoke impacts. And we know now the impact on placentas with pregnant women. There's babies can be stillborn or not thrive or be underweight because of the impacts of smoke. And this happened after all that for weeks and weeks. A lot of you would remember that. And of course, firefighters. Lots of firefighters just didn't come back after those fires. People that I worked with, I remember one person who I thought, this person's a star, had been a paramedic in London, moved out here, wanted to be a firefighter. And she said to me afterwards, I was just terrified that night on Hat Hill Road at Blackheath. Just, I've never seen anything like it, and I never want to see it again. And so that's, but the fatigue, loss of income, going for months and months and months, and there's been a drift of volunteers away from organisations after these fires because it's just more than you can think about. But look, climate extremes, every 1 degree increase in temperature means 7% more moisture in the atmosphere. We're at about 1.5 degrees, so we get these massive downpours as we had in 2020, 2022, floods. That promotes prolific growth, and when we get the climate whiplash back to dry, you've got so much more fuel to burn. But heat waves are the big killer, and hold that thought. Look, just this is my last slide. You're going, whew, he's a bit over, but before 2018, huge fires in Queensland, big fires in New South Wales, and we had no large firefighting aircraft because they were being used in Northern California. We had a lot of senior fire personnel from Australia over in California helping, and so we had trouble with our incident management teams when the South Coast started burning and we were losing homes in August. I rang around former colleagues, ended up, cut a long story short, 38 former fire and emergency service chiefs from every fire service in Australia. We tried to talk to the Prime Minister at the time, the one holding the lump of coal, about the looming fire season. Didn't want to know because we mentioned climate change, and that was a no-no. So we stuck to our guns because we were credible. And you talk about organisations like Doctors for Climate. When you have facts, get them out there. And we spent a lot of time, I spent a lot of time in the media debunking the myths, like it's arsonists. Well, no, it wasn't. There was less arson than during a normal year. It's the Greenies stopping back burning. Well, no, the Greens aren't in power anywhere except sort of in ACT, and all of the regulations, environmental regulations limiting burning, been put in place by Liberal National Coalition and Labor governments. Then, the 1851 fires were worse. Well, who says? Oh, look at this headline from Melbourne. Well, there were no fire services, no Bureau of Meteorology, no proper weather observations, no forestry, no national parks, and the fires burnt, and it was probably hot. But, so this was misinformation, and it's an industry. The fossil fuel industry put millions and millions of dollars into disinformation and misinformation so that they can continue to reap profits. Well, we pay on average $20,000 per household every year because of the impacts of climate. So it's essential that we get out there. I've gone over time. Thank you very much for listening to me. And
thank you, Greg. I knew I was going to be scared, but not this scared. Thank you, that was fantastic. We'll have you back shortly when we go to a panel. So just by way of continuing the story, we've got two more things to do. One, we just wanted to touch on a few things that the Institute is doing in its response to try to provide research evidence, research observations, Patrick, to help with that, combating misinformation and getting research evidence into people's minds. So the Institute is a large group. We've got 4 research centres, university research centres, looking at various aspects of how do you have better healthcare for the population of Australia, but also internationally. And these are the directors of our institutes. We've also got a board which is kind of like the who's who of key opinion leaders within the university and externally within the health system. We're always grateful for our board and the advice that they give us to help steer our research strategy. We've got about $65 million worth of projects going on at the moment in the Institute, and another $121 million where we are investigators on other people's research, research dollars that are held elsewhere. And I noticed that Deputy Vice-Chancellor Research is here. We're trying to reverse those numbers for you, Deputy Vice-Chancellor Research. We also have 174 projects going on, quite a number of them, and increasingly more in this health system sustainability climate change area. And we publish, if you can take a couple of facts away, if you're new to the Institute, we publish more than one paper for every day of the year. So if you're ever in danger of running out of reading material, we have a solution for you. We publish a study or a paper every day of the year. We've got about 300 people associated with the Institute, including visiting fellows and professors. We also supervise the MD program candidates because our MD students, our medical doctors in training, do a project and we supervise those. We help coordinate their research component. And we've got 86 graduate research candidates, mostly PhD and Masters by Research. So what do we do in the Institute? Well, we do a lot of work on climate, but we also do a lot of work on AI and big data and patient safety and learning health systems. Generally, we try to do collaborative and impactful research that's innovative because we want a better health system. Whilst all of this stuff that Greg's been talking about is going on, we have to continuously improve the health system so it's fit for purpose. We look at performance and implementation of new ideas, some of which we design and some of which other people do, and then we try and implement them with a partner. Henry Cutler's here and he'll talk shortly. We do a lot of policy and economic analysis. And really what we're trying to do is take this complex adaptive system called healthcare and this other complex adaptive system, the 28 million people in Australia who need healthcare, and we try and figure out through our research how we can make for better healthcare for those people. That's, in a nutshell, what we do. Just on climate change, we've done a lot of work culminating in Ivan Zarinsky, Kaylin Smith over there and myself editing a book with 74 of the world's experts saying, what can we learn about health, human health and climate change at its intersection? Like Greg, you don't have to buy our book, but there are summaries available if you wish. Just send us an email. So you can't summarize a whole book of hundreds of pages, except you can, because this slide summarizes it. The climate crisis, which Greg's been talking about, is inextricably a health crisis. To prepare health systems for the future, climate change must be seen as a priority issue. And we've swallowed that pill, and that's what we now do as a major part of our research. So Greg explained much better than I could the effects of climate change, but in summary, climate is affecting health outcomes, injury and mortality from extreme weather events, heat-related illnesses, respiratory illnesses, waterborne diseases, zoonoses, vector-borne diseases, malnutrition and foodborne diseases, non-communicable diseases, and mental and psychosocial health, which you finished on, Greg. So all of those are affected by a changing climate. The other thing we're worried about is at the very time you need a functional health system, the fire comes along or the flood or the cyclone and knocks out the health system. So at the very time you need functional GPs, emergency departments, hospitals, they are likely to be not functional. Now that's a major double whammy, So we've done a lot of work on that. So in essence, healthcare has a bidirectional problem. On the one hand, healthcare, as Greg said, is a major emitter of greenhouse gases. I don't know if you know, but if you think about different industries and how much they contribute to the carbon footprint of the world, greenhouse gases, healthcare as an industry produces more greenhouse gases than the aviation industry and the maritime industry combined. So when you ask the general public what's driving greenhouse gases, they'll probably say, well, there's a lot of planes in the air and there's a lot of ships on the sea. No. Healthcare produces far more greenhouse gases than both of those industries combined. So we really have a problem to get to net zero. And the other bidirectional bit is healthcare's on the front lines. Matt Knox, we're going to hear from the emergency departments, especially general practices, get an influx of patients every time there's a heat spike, every time there's a flood, every time there's a cyclone, every time there's a major climate-induced problem. So there's more and more pressure on the health system that wasn't accounted for 5 or 10 or 15 years ago in the way that Greg has explained to us. And we got this bidirectional problem. We got a lot of studies going on. One of them I'd just call out, and that's the work of Enrico Coira and Hania, who's going to talk to us shortly. And that's the MQ heat trial. We're trying to get early warning to people when there is a major event so that they can be prepared. And we can talk about that with you afterwards if you wish. So if you want a summary of all of this, we've produced a report, 2026, The Impact of Climate Change on Human Health and Health Systems, Bridging Research and Actions for a Sustainable Future. That's on our website. If you want a personal copy, we'll give you a personal copy and send it to you by email. And that summarises about 50 papers that we've already published in this area, trying to provide the evidence and observations in Patrick's language for climate change. So that's enough from us. If that's interested you and you're not part of our institute and you want to work with us on these sort of problems, come and talk to us. We're very collaborative. So let's hear from the panel now. Could I have the panellists, you know who you are, come up and join us, and I'll introduce them as they do so. Professor Paul Beggs is one of the first people I noticed when we came 11 years ago to Macquarie and his work. He's an environmental health scientist and professor in the School of Natural Sciences at Macquarie. And his work is at the intersection of climate change, healthcare, public policy, and policy. Dr. Matt Knox is an emergency physician and deputy director of the emergency department, and he's the clinical lead for sustainability at Wyong Hospital. He's really interested in what I just said before. Well, what about emergency physicians and their skills in being able to combat and cope with this influx of patients that we get? And he's also very prominent in the Australasian College for Emergency Medicine. Professor Henry Cutler is out of order. How dare you, Henry? Yes. That's all right. You're in order then, Henry. I will still introduce you now. He's a health economist, and he's interested in what the health system produces in terms of productivity and value. And that's important because it's going to have to produce more productivity and more value because of all the things Greg has been talking to us about. And he's very interested in adaptation and resilience of the health system and how we're going to invest in that for good capacity building. Professor Yvonne Zarinsky is Professor of Health System Sustainability here at the Institute. She focuses on how can we make healthcare more resilient and sustainable, and has done a lot of work, especially in real work settings, trying to think, how do we have a workforce that's fit for purpose for the future? Dr. Hania Rahimi Ardabili is a research fellow, and with Professor Coira leads the HEAT trial that I mentioned just before. She's focusing on digital solutions to climate change adaptation. And Greg, thank you for rejoining us. Could you please welcome our panel? So there's too many questions and not enough time, but I'm going to start with you, Paul. You're director of a research centre that looks within the region and working with the Lancet countdown. So I guess the question for me, for you, is, so there are all sorts of population health issues here about climate change in the way that Greg has been describing. Just talk us a little bit about that. What's the work of the Lancet countdown and your research group?
Thank you, Jeffrey, and thank you, Greg, for an amazing presentation. So I lead a regional centre, the Oceania Regional Centre of the Lancet Countdown, which is the leading health and climate change collaboration around the world, involving about 300 researchers from all sorts of countries, regions and so on. And the job of the Lancet Countdown is largely to track the impacts of climate change on human health and our response to it. We're also heavily into communication and policy engagement. So we do rigorous research and then we translate that into real-world action. And that's occurring in Australia with the establishment of a health and climate change unit, for example, in the health department, the new CDC within Australia, and a whole range of other ways. So I think fires is obviously one of the big impacts of climate change on human health through direct exposure. So Greg talked about the deaths through direct exposure, but also the impacts of smoke on our health. And the health impacts of the 1920 fires in Australia are still being explored, so we don't know enough about that long-term impact of smoke. So what we've been doing is developing indicators. So we produce a report every year. In Australia, we publish in the Medical Journal of Australia, and we develop these indicators so that we know whether we're getting the action that we need in this really important area. At the same time, we work with our colleagues overseas, so University College London, the Wellcome Trust and so on, really where the global effort is occurring at the moment. So, Jeffrey, you really nicely summarised the many impacts of climate change on our health. So direct impacts through things like heat, fires, tropical storms and so on, but a whole range of indirect impacts on our health as well. So vector-borne diseases transferred by mosquitoes, ticks and so on, air pollution, allergens, and very importantly, impacts on mental health as well. So with our report that we've just submitted to the Medical Journal of Australia, we now have a mental health and climate change indicator looking at the impacts of climate change on child mental health. And I think that's a really important area because that's going to have lifelong impacts on many Australians. So I think the impacts are with us now. So this is not a future issue. It's occurring as we speak, and Greg really highlighted that issue. And the impacts of climate change on our health are occurring everywhere. So there's nowhere on the planet that is immune to these impacts. One of the big, to finish up, one of the big findings from the global Lancet Countdown report published at the end of last year was that we now have about 500,000 deaths from heat waves every single year globally. And that's just one impact of climate change on our health. As I said, there are many others. So it's a massive issue. It is the key health issue of our times. So it's great that you've run this session. And thank you again, Greg.
Thank you very much, Paul. Paul, I just wanted to, on behalf of the Institute, actually thank you because you and Leslie Hughes were two of the people who really inspired us to do all the work we're now doing on climate change. So I just wanted to make that public appreciation. So you've heard all this, Matt Knox. You're an emergency physician, so you're really at the sharp end having to deal with this in a different way from the way Greg has to. So what should a hospital do to prepare? You see, climate-induced patients more and more, and you will see a lot more in the future. What should a hospital do to prepare?
I'll agree, it's certainly happening. We see it already in the emergency departments, people coming in, even without a huge weather event. If there are some blackouts because of some bad storms, people come in, their oxygen concentrator at home can't work and therefore they can't breathe, and they come in and they are technically not acutely unwell, but they are taking up a hospital bed and make us even more overloaded. And that's just one sort of small example of how the hospital system is already being quite significantly impacted by climate change, and that's in the context of the health system already running on an oily rag, and it's one of the few things that seems to have bipartisan support is squeezing as much as you can out of the health system and making it run very lean. But there's a lot of things that we need to do. There are some things that are already happening that is just, it's good, steps in the right direction. It's not quite enough. It's good in our hospital up at Wyong. We've got a massive solar array. Actually, every useful roof space has been taken up by solar, and we've got a few batteries in there as well. And so the hospital kind of can run on its own during the day, but we need to get better at storing that. And that's one of the ways that we could be a bit better at adapting to the, if the electricity infrastructure starts to go down because of some big weather event, we might be a little bit more independent. It might be strange for a emergency clinician to talk about public health, but I think the lowest carbon and the cheapest healthcare is not to have to treat the person in the first place. And so what we really need to do is to make sure that people are well in the community, and investing in primary healthcare is the way to do that. There's lots of different ways to do that, but it needs to start before the hospital is involved at all. And so every dollar that you spend in that sort of realm is going to pay back multiple fold. The hospitals themselves, I'd like to think pretty simply, what does a hospital need to keep functioning? One of those is staff. And so it's really important to make sure, already, I got a text while I was sitting in the audience here. There's a local hospital that's in an internal disaster right now, purely because it's completely overloaded and they don't have enough staff. Climate change is contributing to that, but there's no big event that's happening right now, right? And so, as you were sort of mentioning before, if something big happens and we're already in that sort of state, I don't know how sometimes with fire services, they do have some good. You guys get massively stretched when there's big events, but when that's not happening, there's an understanding that those resources need to be there and available, right? Health doesn't seem to have that. We're constantly running on the oily rag, and so that sort of policy needs to change as well. And so making sure that we have enough staff that we can continue to function normally with a bit of fat in the system is important.
Yeah.
Oh, look, there's heaps more, but we're running out of time. So
Sure. Thank you very much. Thanks, Matt. Yvonne Zarinsky, you're a professor of health system sustainability, but you've got a passion for the workforce. What does the workforce need to do to change, and what research do we need to help the workforce?
Yeah, so what Matt is saying is...
sorry.
No, not at all. Just to follow on from what you said, it's absolutely right. The workforce is already stretched. They're probably the most stressed workforce in Australia, and most stressed professional group. There are about 1 million doctors, nurses and allied health professionals in Australia, and they're a really strong advocacy group who can advocate for climate change action. After all, they see the effects of climate change every day on the front lines. They're also stressed by these events, and recovery is not immediate. Health systems and health professionals don't recover immediately, and yet they're not supported in the long term. So the trauma that Greg talked about for the firefighters, there's trauma among health professionals as well. And it's long lasting, so we need to support their resilience and their mental health as well. The other point I wanted to make is that we did a survey of 6,000 Australians led by Kaylin Smith, and 20% of people said that they looked to their doctors for advice on how to prepare. And yet we don't know to what extent doctors are actually prepared and have the capacity to provide that advice, exactly for that reason, that to keep them out of hospital. So there's lots of work to be done in this area to increase resilience of the health workforce and the health system, because there is no health system without a resilient health workforce.
Thank you very much, Yvonne. Hania Rahimi Adabili, you are looking at digital innovation as a solution, or partly a solution for this. Tell us about that.
Sure, Jeffrey. It's a very important question that you raised. So I start with its impact with individuals, because it's also indirectly helps health system. Because digital health has that impact that extends care beyond clinic and hospitals. It can empower community members to protect their health with the right sources of information. So we tailored information for them. It empowers community to protect themselves from climate events, which obviously not only keep them healthy, but also helps health system to focus on people who need it the most and free up that pressure from the climate health system when the climate events happens. As Matt said, our hospitals would be quite stretched with their resources, so it needs to be prepared for such events. Particularly, it's important for vulnerable people who may not realize that they are at risk. It could be potentially great for them because obviously with digital technology you can bring various sources of information like weather information and health information together to provide a right source of information for people to protect themselves. So it's all about right information at the right time and the right people. So 3 rights. But at the system level also it can help with surveillance, with resource allocations and identifying vulnerable population as well.
Thank you very much. Henry Cutler, you dedicated your career to having better investments in the right place in healthcare. So what should we do in this area? How best can we address the sustainability challenges through investment?
Thanks, Jeffrey. Yeah, so going back to your bi-directional problem, we can think of investment as 2 types. So the first is really trying to reduce the carbon emissions from the healthcare system, investing in not only health infrastructure that is sustainable, but also looking at supply chains within the healthcare system to make sure that we're purchasing from those that are environmentally responsible. The second component really is the increasing the healthcare system capacity to respond to somewhat random events. And when I say random, it's really about the location of those events and also the timing of those events. The first part of that is investing in further intelligence that looks at the relationship between these climate events and healthcare system needs, health needs and healthcare system requirements to address those needs. And there would be some certain patterns for floods and for bushfires and for heat that would give us a good indication of, once these events occur, how do we best address those the healthcare needs associated with those events. The second part is investing and strengthening the capability of the whole healthcare system. So rather than just relying on emergency department hospitals, making sure that there is an investment in the ecosystem within the healthcare system, and in particular the relationship of urgent care clinics and GPs to responding to some of those events. The best way to make a hospital more sustainable is to keep them out of hospital. And so if we can invest in pathways that allow us to do that, maybe it's healthcare teams that move from one place to another in response to events. The third is what's already been discussed, which is building a flexible workforce, but also building a flexible infrastructure. And a really good example is in 2019 I travelled over to Israel with a group of people to look at digital health. And as part of that we visited a hospital which was an hour's drive from the Lebanon border. And that hospital could shift its entire operations from the ground level to the car park in 24 hours. And that was in response, obviously, to the threat that they faced from Lebanon. And so you can imagine, something within in the hospital setting, having some spare capacity, building some spare capacity to respond building infrastructure spare capacity to respond to some of these events. Now that's difficult because there is some randomness in where these events occur. But the other problem is the way we think about investments. There is, when we think about an investment in infrastructure, it's cost-benefit analysis, and it really focuses on the now. It doesn't focus on the future, and it's hard to convince a government to say, well, let's build in 10% spare capacity just in case we're going to have an event. there's no way they're going to do that, because as we've already heard, it's hard enough keeping up with events when they don't occur. They're just every day. And then the final is investing in understanding the equity implications of these investments, because we know that these impact lower income individuals, lower socioeconomic individuals more, because they have less capacity to respond to those events.
Thanks, Henry. That's very useful. Greg, you're our guest today. I wonder if you've got a final word. What should health systems be doing most urgently? Because you've given us such a challenge.
Yeah, fascinating hearing all the different aspects, but it's very reassuring to hear that there's so much thinking going on about how to sustain the health system. And one of my retirement jobs is I'm chair of the ambulance service advisory board, and had a colleague here before. But and as a mobile health service, they're really struggling. And when the heat goes up or the smoke's in the air, their workload is huge. And there's big efforts to keep patients out of emergency rooms. So a lot of innovative stuff going on there. But look, Paul talked about heat waves, Matt talked a bit about heat waves. Heat waves are a big killer, and we're seeing in Europe at the moment, across France and Spain in particular, thousands of deaths because of heat. So bushfires are very visible and frightening, but it's actually this relentless heat that we're seeing. And when I was a kid, yeah, you get hot days over 100 degrees. It was the old, it's called Fahrenheit. But it's so common now. There's so many more hot days, and the elderly, the people in lower socio-economic stratas, isolated Indigenous communities, they're impacted in such a huge way like this, and there's nowhere for them to escape. So there's a lot of thinking about that early, what they call an early reap, people who are already comorbidities, etc. You get a hot day, and a lot of those people die. And it's how can we get people to cooling centres? So that's a big one. But look, overall, yes, the health system, I didn't know just asthma buffers, Ventil, and it's hydrocarbon, and it goes up and helps warm us up. But phasing out things like that, nitrous oxide, there's lots of things the health system can do that are fairly quick wins.
And the health system are doing those things, but maybe not fast enough.
Yeah, and look, I think it's because now with the fire services, what we're finding, we're getting so much busier operationally, where the biggest bang for the buck is community education, getting communities in a space where they can help themselves during a fire. And I saw this in 2001 when Lancet National Park went up again. They had community fire units, which weren't there in 1994. Similar fire, we didn't lose any homes. And but because the fire services are so busy, they're not doing those smart things. They have to pull back on it because they're just, and the health system to me, not enough people, not enough money, health agreement between the states and territories and the Commonwealth. Western Australia is stealing all our GST, sorry. There's not a fair allocation of tax dollars, and there's money there that should be going to the health systems. But hats off to everyone. And I've just got to put in the last plug. Paul worked with Professor Leslie Hughes, who's been a mentor of mine for years in the climate space, and thank you for all the work you do, and you and Leslie have done.
Well, isn't that fantastic? Could I draw this to a close? Firstly, could we thank the panel for all the wisdom that's been discussed? And secondly, just to conclude, I just wanted to thank the people who behind the scenes make all this work, and especially Prissy Clay, Ronika Patel, Rachel Yang, Pippa Doricott, Denise Siros, Kirk Olsen, Kelly Smith, Jessica Yu, Carolyn Proctor, and the Observatory on the Future of Healthcare, which is within the Institute and it does all this work. So could I thank all those people, and you should thank them too. Thank you very much for coming. If you're on our list, you will get notified about other events that we have, but could we thank you all for participating. All the best.